In many offices, the medical assistant is required to take an in-depth history of the patient's present complaint. This requires showing empathy in all your communications with the patient, being non-judgmental, and actively setting about gaining the patient's trust. Let's follow Anna as she interviews Mrs. Lawrence.
Go ahead and have a seat, Mrs. Lawrence. It's good to see you again. Now, when we last saw you for your pap smear about a year ago, you were feeling well and everything was normal. What brings you to see Dr. King today?
I've been having pain with my periods, and it's getting worse each month.
Now, how long have you been having the pain?
About 6 or 7 months.
Now, can you describe the pain?
It's real low down, right down here. And then it comes and goes like cramps, and I feel as if I want to bear down. My periods have gotten a lot heavier and last for a whole week now.
Any change in the regularity of your periods?
I never seem to go a full month anymore. And right before I have my periods, I've started to get a lot of back pain.
Now, can you tell me any more about the backache, exactly where it is and what it feels like?
Well, it's real low down, and then it seems to come around here and into my groin.
Now, is that the same on both sides?
Pretty much.
Anna's documentation of the history up to now gives the chief complaint in Mrs. Lawrence's own words. For the present illness, she summarizes accurately the pelvic pain and changes in her menses that Mrs. Lawrence has described.
I can see you're worried by the pain, Mrs. Lawrence. Have you found anything that relieves it?
Lying down eases it when I can.
Have you taken any medication for it?
I take ibuprofen. Most of the times, it's bearable.
And have you noticed any differences when you have intercourse?
It hurts lately. The last 2-3 months, it hurts right at the top.
Do you plan to have any more children?
Well, you know, I had my first 3 kids from my first marriage right out of high school. The last 3 years with my marriage to Mike, we've used no precautions, but no luck, no children.
Are you having any problems when you go to the bathroom or when you pass urine or stool?
The urine's all right. But when I go to pass a stool, it's tight and it's sore down there, and it takes a while.
Have you noticed any other problems or symptoms?
No. Everything else is fine.
Your appetite, your weight, they're both normal.
Appetite's good. The weight's steady.
Any problems with your breasts at all?
Well, I examine my breasts like you showed me every month after my period, and they feel good. The only thing is this pain down here.
Is there anything else you want to tell me about? Is there any specific problem that you're worried about? Any particular disease that you may be concerned about?
You mean sexual diseases? Michael's very faithful, and so am I. But I am scared about cancer.
The final section of Anna's documentation accurately listed her other symptoms, the rule-out responses about pregnancy and STDs, and also indicated Mrs. Lawrence's concern about cancer. In fact, there was no evidence of cancer, but eventually, a laparoscopy and biopsy showed that Mrs. Lawrence had endometriosis. This is a condition where tissue similar to that lining the uterus is attached to the peritoneum of the pelvis. During the interview, Anna's caring and concern were expressed through her facial expressions, a calm, reassuring voice, and gentle touch. Most of her questions were open-ended as an invitation for Mrs. Lawrence to express her feelings about the symptoms. Anna did not put up roadblocks to communication in the form of empty, meaningless phrases, which can indicate to the patient that you are not concerned or interested in her problems. After Anna had completed taking the medical history, the next step in preparing her for Dr. King was to take Mrs. Lawrence's vital signs. During the medical history, questions are asked about specific body systems. As a continuation of this, Temperature, pulse, respiration, and blood pressure are the 4 vital indicators of body functions that are essential to life. The vital signs give the physician an assessment of the status of the brain, the autonomic nervous system, the heart, and the lungs. The vital signs indicate the body's ability to control heat, the rate, volume, and rhythm of the heartbeat, the rate and quality of breathing, and the force of the heart and the condition of the blood vessels. Therefore, vital signs are a continuation of the exploration of body functions that began with the medical history and will continue further with the physical examination.